How can an interim leader help a hospital or health system get back to black and ensure that financial sustainability is on the horizon?
I actually have a story about this. Prior to COVID, and actually when COVID started happening, we had a situation where we had a vacancy in our um, chief financial officer area, and the organization, as COVID started to really obviously continue, we had some intense financial pressure on our organization to reduce our costs quickly and responsibly, and so we brought an interim CFO in with the mandate to identify some cost savings in the organization, opportunities to really enhance our financial operations and to restore some fiscal discipline. That interim, we interviewed a number of people, honestly, for this role. The industry experience really mattered quite a bit for us. And also, when we looked at who we are identifying as a candidate for our organization, looking at whether they had for-profit or nonprofit experience was also something that we considered as well, given the situation, and what would translate with our organization, how to effectively move our organization in the direction we needed to go into. In addition, in looking at this, we looked at the cost of having the vacancy versus not, and filling it maybe with somebody that's new to the role, be a major promotion and difficult to fill position, and whether that person was ready to take on this role. But even, a short leadership gap in the CFO position, was a problem in this time period, especially obviously during the pandemic, and whether that would impact greater inefficiencies and strategic drift, given where we were during this time period. So for us, in looking at interim leader, we really could not afford not to have somebody in this role during this time period, and it was directionally, obviously, really directly tied to revenue and cost containment for us, and that's just one example of really successful interim leader that we brought into the organization that really helped us during this time period.
I'll jump in on Sheri's wonderful example, and I think that that's fairly a common opportunity for clients considering interim leadership. As I had mentioned before, the cost of delay is counterbalanced with the speed of completion. So if you think about key transformation efforts and strategic efforts that all of our health systems are undertaking right now, the cost of delay while we're waiting for a permanent executive to come in can be a derailer down the road, particularly for those health systems that are in a highly competitive market. So envision the ability to accelerate your transformation and keeping those projects on time, even ahead of time. The other opportunity for consideration in interim leadership is the capacity that an interim leader can bring. Thinking about a just-in-time executive leader that's brought in to help build capacity so that your executive leaders, who all of whom, as we talked about burnout earlier in the webinar, have more than enough on their plate. And yet we are redefining our revenue models, our expansion models, partnership models, et cetera. And those take attention units from our key leaders and our executive teams. Now imagine an interim executive leader coming in and helping and be that capacity builder, that expander for your team that is time limited and able to help you and your organization accomplish your transformative ideas while not further burdening already at capacity executives. So that helps with retention on that part as well.
I would add, just in terms of leaders that we have out on assignment right now, I can think of some that are doing amazing work with revenue cycle, really bringing up yield and helping directly feed bottom line. I can think of supply chain folks as well, doing some masterful things for our clients. But I also think of just really every role that I'm involved with discovery calls on, OR directors who are helping improve efficiencies and increase charges flowing through. The other thing that I would point out, though, and it's somewhat tied to the burnout, and I'm talking to more and more clients about this, and that's a protection of those most trusted those most vulnerable in systems that we stretch too far and too many times. And what happens is, and I think we all would do it, and it's very, very natural, we stretch and we see if somebody can cover more and more and more. And what happens is we do that in succession, and then we turn someone who's looking for another permanent role out in that competitive environment. So that can really hit on a financial basis as well. So I would add that to the mix.
And Erica, I would also even add that, a couple of things. When you're putting, Ben just hit it pretty close to home, like when you're putting a person in a position to manage productivity or throughput that has that experience in really getting those financials fine-tuned, come back to my previous comment when we're doing an intake for a client, really understanding if they've got that for-profit experience, as Sheri mentioned, or the nonprofit experience, because understanding that landscape is very different based on those roles, right? And so I think when we're talking about getting back to black from a revenue standpoint, getting interim leaders that understand that, they can, as Sam said, really take that by the learning curve, I think, take the learning curve out of it. And there's an insurmountable value in bringing that forward very, very quickly. Plus, I would almost challenge any recruiter that's out there. There's a cost to recruiting, whether it be a physician, a C-suite executive, or a manager. There is that cost associated with recruiting. So if you can bring someone in, bring them in quickly, and really have them manage that effectively, it should bring your overall cost of recruitment down instead of up.
Yeah, I may just add one more thing here, and what a great topic, right? And so crucial and important to every executive right now that is living through the time of managing to cost, managing to margin. Maybe hitting on the point Preston, Ben, Sam, and Sheri have made, right, is setting the rigor and understanding the structure of what is the project, what are we after, doesn't matter what the specialty is. But recently sitting with one of our partners, right, such a compliment to hear that individual call out, I know a B.E. Smith interim any time of the day, right, because once we've set those objectives, we've got a great team, right, that supports, and they're reporting out on what they're doing, right? So I think a differentiator is not only to be able to call out what we're doing at the beginning of that process, but, coming from that individual then after, a differentiator of being able to report to how the outcomes are going through the project. When you're looking for an ROI, it doesn't matter how you're quantifying that, there's going to be a difference maker in how you manage through the process and report to the outcomes at the end of the project.